Hey guys, welcome to another episode of Tech Tuesday. I've got Jake Rothstein with Upside Home. Did I do that right?
Just upside. We're just
Just
upside.
Upside. We're going to have an amazing conversation. I'm sorry, I'm really super distracted. I have a big announcement later this week. Big things going on. I can't tell you anything more than that except to tease that. But you'll learn Thursday or Friday, I think, what this big announcement is. And yes, Jake already knows. I spilled the beans to him privately, but don't ask him. He can't tell. Anyway, so we're going to have a great conversation. But first, this. Hey guys, Steve Moran here. So Jake, you first started out doing this organization, this company called Papa, that helped us rethink aging and companionship and conversation. That should have been enough. And then you went off and did this new company, Upside. Talk to me about all of that and what you're doing.
Yeah, it's great to be here, Steve. Thank you for having me on. So Papa started out of a family need. We were trying to figure out how to help my grandmother help my grandfather with he had a recent diagnosis of Alzheimer's. And so we said, oh my God, there's 20 million college students in the United States, and there's all of these older folks that need a little bit of extra help at home. They maybe don't need full-time care or actually caregiving duties or help with ADLs, but maybe they're just shy of that. They need some companionship. They need some assistance, and that was the kind of the impetus for Papa to try and help my grandmother deal with my grandfather, the care for my grandfather. And what happened next was interesting. As Papa was growing, we realized that. Well, what wound up happening is my grandfather started to become too much of a burden for my grandmother. And sure enough, with his Alzheimer's diagnosis, he declined to a point where she could no longer care for him in the house. And so we made the decision as a family to move him to a memory care community and locally. And that was really good for him and good for her for a number of reasons. One was because now she had her life back to us. The bad thing about it was that she found herself alone for the first time in her adult life at 87 years old, in pretty good health, but now blowing through her retirement savings to pay for his care, and also living in a house that she could no longer afford or navigate. And so they had built this 2-story house for retirement, God knows why. And she had just had knee replacement surgery. And so she can't navigate and can't walk up and down stairs to the bedroom. And she's 87, right? So she's in pretty good health. So she had to figure out how to outlive her money, or to have her money outlive her. And so the family gets together and we go, well, this is not sustainable. We got to move her. She's not ready for senior living yet. She doesn't really want to be in that environment yet. She's very social. She's got her own friends, blah, blah, blah. So we sell the house. We use the equity she had in the house. And we found a great apartment for her, a little 2-bedroom, close to where her doctors are and close to her grandchildren. And I sort of stepped in as her closest grandson and said, hey, I can help with all these things. I'll help you with transportation to the doctors, and I'll help you with grocery shopping, and I'll help you pay the rent. And it was the perfect situation for her. She was now closer to her friends, and she had a unit that she could navigate and afford, and she was going to not have a problem with money for the rest of her life. And she could see my grandfather when she was able to, but she didn't have to be burdened by the difficulties of his care and his decline. And so it was a great situation. And it opened our eyes to this problem that 90% of older adults, when asked if they want to age in place, they say, sure, yeah, of course we want to age in place. But at some point along the aging journey, something happens to where you can no longer age in place. There's a trigger event. We had categorized them at some point. What we called the 5 Ds: death of a spouse, disaster, divorce, disability, or the need to downsize. And my grandmother, obviously because of my grandfather, had this need to downsize. And we said, oh my God, there's an opportunity here to cater to the 90% of older adults that say they want to age in place but can't, and aren't ready to be that 10% or 8% of older adults that need or want to be in a senior living community.
So talk to me a little bit about how it works.
Yeah, so how it worked then is very different than how it works now. So I'll give you a little bit of the story, and this maybe goes into a little thing or two about where we failed in the past and where we're succeeding now. So we started the business under this premise. We said we're going to build the biggest senior living community in the world without laying a single brick. And that was our spiel at the beginning. And the way we did it was we were going to use existing apartment community infrastructure. We said, okay, we're going to vet these places to make sure that they're safe and accessible and affordable for older adults. They're going to be inherently intergenerational buildings with all of the access to services and amenities that you can think of. And then we're going to give and sort of assign a single point of contact, like a grandson or a granddaughter, to every single one of our residents that they had access to, normal business hours that could help them with things like transportation and food and groceries and things like that. And that's how we started. And we started placing people under this model all over the country, kind of onesie twosies. They were all over the place in buildings that were in our network. And what happened over the course of a couple of years is we started realizing that there was a really big impact that you could have on health outcomes, on medical cost reduction, as a result of keeping people in appropriate settings, not aging in a senior living community necessarily, but aging in the right place for them, in a place without stairs or in a place where there's other people around, or something that met their needs. And that's what brought us to this most recent iteration, which is now a few years going, in our work with health insurers. And health insurers come to us and they say, well, we have these populations of all types, older adults, people lower income, people with disabilities, that are not adequately housed or not sustainably housed. And we need your help to figure out how to do that.
So talk to me a little bit more about what happens with those people. I'm 85 years old. I'm living in my apartment by myself, not getting the things done I need to get done. I've got a family member who's sort of trying to take care of me. I'm sort of trying to do it myself. Neither one is working very well.
Yeah, it's really hard. Typically what happens is you're a member of a health insurer, a health plan. Maybe you're on Medicare Advantage, maybe you're a dual eligible Medicare Medicaid member. And maybe you're fall within a very vulnerable category. Maybe you have multiple chronic illnesses. Maybe you're, incredibly expensive to the health plan and also just a vulnerable person because you have a lot of health risk. Those types of people typically get assigned a case manager at a health plan. So that health insurer will have a case management team that is assigned to a specific number of older adults in this case. And their goal is to outreach and to make sure that they can help them with the things that they need help with. Let's make sure you get to your doctor's appointments. Let's make sure you get your primary care visits. Let's make sure you're housed appropriately. And there are requirements around making sure that people are adequately housed. Social determinants of health has become a really hot topic for health insurers. And it started sort of in the PAPA era in 2020, 2021. And it's carried through beyond just loneliness to things like housing and transportation and food insecurity. And so housing is coming up in many, many of these conversations that case managers at health insurers are having with members, especially among the most vulnerable. And so what happens is when a case manager does talk to one of these members and housing instability comes up, and I should preface this by saying housing instability is not what most people think of housing instability. It's not the person living under a bridge or in their car necessarily, although those are housing unstable folks. It could be people like my grandmother that's living in an unsuitable place for her, and she's at risk for falling down the stairs or at risk for eviction because she can't afford a rent anymore. And so the spectrum and the breadth of housing instability is very, very much larger than I think we thought at the beginning. And so what happens is a case manager is now talking to this person, and the person goes, I'm at risk for eviction, or I'm going to fall down my stairs because I just had a knee replacement. And then they connect them to us, and we provide health insurers with a housing easy button that allows them to take these cases, these members, and refer them to us quickly and securely. And then we use our national network of housing, and that includes multifamily, single family, rooms for rent, everything under the sun, Section 8, in order to match people with appropriate housing and do it really, really quickly and much more quickly than anything, any other solution that's out there.
And so so they would move into one of these housing units that you have contracted with, have a relationship with, typically in their neighborhood, with a companion or still solo?
It varies. It depends. We have seen cases where we're finding companions for people. It's fewer and farther between. Most of the cases are solo. We work in a lot of Medicaid, populations where we're talking about kids with families. I know that's not the topic of conversation here, but most of the members that we house today are living in their own places.
So have you explored, I'm sort of going back to your grandmother's situation, right? So you've got this 2-story house. Um, is there opportunity to, I don't know, put college students in extra bedrooms there to provide the services and generate some rent, but at a lower rate? Have you looked at doing that kind of thing?
Yeah, we've looked into, if you could dream of it, we've looked into doing it.
Okay.
There's risk associated with that, especially as we start talking to health insurers, right, who are very risk averse,
Right.
big organizations. Yeah. So I think there's a hesitancy from their standpoint to start putting strangers together in units. I think that we've decided that we're going to take this crawl, walk, run approach, where we say, okay, let's do this first. Let's get your most vulnerable people stabilized. Then, as we take this conversation forward and we build trust in the entire ecosystem, then there's an opportunity to test a lot of these different theories that we know inherently just from our previous work could work and will work, because the need, Steve, is so dramatically large.
So who pays for, I guess I got to ask this question, two questions actually. Who pays for this, number one, and how many people are you serving?
We're serving thousands and thousands of people every month across the country, which is really exciting. Who's paying for it? So the people that pay for it, the navigation, the tenancy sustaining services, what we call it, to get people housed and keep them housed, health insurers are paying those dollars. And the reason that they're paying those bills is because we've articulated a very clear return on investment for them, ensuring the most vulnerable people are housed and housed stably. Now, dependent on population, there are also dollars for things like rent. People that are aging out of foster youth, in many cases, there's coverage for 12 months of rent for them. In the case of older adults, there's less of that coverage. However, one of the things that our team is really good at, and we've built a whole organization around kind of unlocking resources for older adults, is many times people don't know what resources they have access to. And so they just need someone to help them understand, oh, well, I'm actually eligible for SNAP benefits, but I haven't been enrolled. So now I can, instead of spending $300 a month on food, I can spend $300 more on a month on rent if I add it to my Social Security income or my disability insurance income or my 401k income. And so broadening the scope of available housing by unlocking other resources that are available for older adults, in many cases, gives us a huge opportunity to help them get housed stably.
So I really like this a lot. I'm really I'm living this, but I hadn't really kind of put it together as you described it. So as my audience know, I've got my 92-year-old stepfather who's got dementia living with us. Very rough night last night. I was up twice with him. It was not much fun. We're getting ready to move him into a senior community because of those issues. But we have him on hospice, and he's been on hospice for, I don't know, 6 or 8 months now. And he's got money, so it's not that the payment is, the fact that the government pays for it is really nice. But for us, it's less the money part of it than that there's this infrastructure. So we get a bath aide twice a week, we get a nurse twice a week, get a social worker once every month or two, we get a chaplain once a month who comes in. They make sure we have supplies that we need, medications we need, and all that coordination is huge, and mostly it falls through the cracks for people.
Yeah, it's so true. It really is an access. We talk a lot about the affordable housing crisis, and there is no doubt that there's an affordable housing crisis. I think everyone would agree. You're out west, you see it all day long. Even kind of in pockets of the country that you wouldn't think there would be a housing crisis, there's a housing crisis, and so I think we all can agree that affordable housing is scarce and there needs to be more of it. Those things take time. And I've been on in a lot of discussions with leaders in the real estate industry about how we fix these problems and we change zoning laws and all these, policy and, all these crazy implications that are going to take a long time to figure out. Our thesis is, okay, there's not enough housing. Let's agree on that. Let's push it to the side. What can we do today to get the most vulnerable people, older adults and everyone in between, housed and housed stably? And what we've learned is that, and what we're capitalizing on, is the fact that there's not an efficient use or utilization of the existing infrastructure that's right in front of us. And if we could just utilize it a little bit better and understand the actual occupancy in any one of these buildings that you might walk across on Broadway and be like, oh, this building's at 100% occupancy, but actually, the average multifamily building turns over at 30 to 40% year over year, and there's 4 or 5 units available in there today that maybe you don't think about or you can't see, but they're there. And how do we get that inventory matched to the population that we're serving. Oh, well, we're serving dual eligible folks, so they need shower grab bars in there, and they also need a little bit of access to some supportive services, and they also need a first floor unit, and they also, so like we take this real estate inventory that exists right in front of our eyes, we expose it, and then we match it with things that we go collect, things that are relevant to the population that we're serving. So if it's a Medicare population, we have a 180-point checklist that we go and find that's relevant to those folks so that we can match appropriately and quickly.
So do you have a shortage of people, of housing? What's the hardest part for the business?
There's a lot of hard things, as you know. Running a business is not a.
Yeah, you're right. Absolutely.
But the reality is that the supply is incredibly dynamic. So I think that there's a technology challenge there with understanding the real-time pricing and floor plan and unit mix of all of these communities, and that changes every 15 minutes. So you have to be on top of that, and that's challenging. But we've figured that out. And then there's the challenge of servicing some of the most vulnerable people, the people that have no income. Well, what do we do with them? How do we figure out how to get them housed? What resources can we tap into to help them pay their rent? What resources with a health insurer can we use? In many cases, we work with health plans that have something called flex funds. And these are dollars that sit at the state level, typically through Medicaid state contracts that the payer has with the state. And these could be millions of dollars in funding that are things that are dollars that are allowed to be spent on things that are ancillary to rent. So things like security deposit assistance or move assistance or furniture purchases or utilities assistance. These are things that can help unlock so many moves, so many stabilities that we utilize all day long. So we tap into those flex funds in order to get people, like someone says, okay, well, I have the $800 a month that I need for this rent for this apartment. That would be a perfect situation, but I don't have any savings. I don't have $5,000 to get movers and to pay the security deposit and first, last, and security down. Like, just can't do it. We can tap into those dollars to get that, to get those people stabilized.
Cool. So I got a couple questions for you. How does this fit in with PACE? Is it competitive with PACE? Is it complementary?
It's very complementary. We're not working with any PACE programs yet, but there's definitely there's a complementary element here. I think we have to. There's some detail, some finer details we have to think through in terms of how we actually integrate appropriately. But it's certainly complementary. We're taking the load off so many different types of organizations as it relates to that.
Okay, so as you know, my audience is primarily senior living owners, operators, people who work in the industry. So I'm sitting here and I'm watching this and I'm thinking, is Jake somebody who's a villain because he's stealing my residents, or is he a hero because he's going to help me do a better job and help me get my buildings full?
I can tell you that we're going to help you get your buildings full. Here's an example of one of the opportunities that we're working currently in Florida, actually. So we're working with a big health insurer in Florida, specifically on what they call a transition from long-term care population. And this is a population that's over 65, that's very multiple chronic illnesses. They're living in skilled nursing facilities now. Skilled nursing facilities don't have the capacity to keep these people long-term. They're not designed to keep people long-term. So what do? We have to help them transition to something more less expensive, number one, than a skilled nursing facility, which could be thousands of dollars a day, but also something more sustainable. So that means assisted living, independent living, potentially memory care if someone has dementia or Alzheimer's. So these are population pockets that we're working with in a very concerted effort to get them transitioned into traditional senior living. And I think that is and whether they accept some Medicaid dollars or not, there's plenty of private pay dollars available in these populations that a lot of times members don't even know they have access to. Oh, well, Beverly's 93 and she's living in this house that she's got paid off for the last 30 years and it's worth $800,000, but she's a Medicaid recipient, right? And nobody ever thought to think about the asset that she's living on, but it's not liquid. And so we help her liquidate the asset, and now she can move into assisted living for the rest of her life sustainably out of that skilled nursing facility.
Yeah, I really like that a lot. I have a good friend of mine from high school days, so a long time ago, and she works in Northern California I think technically for one of the areas on aging, but basically she's tends to deal with elder abuse and just elders who are at risk, much like you're talking about. And my initial thought would be, well, she's working with people who don't have any financial resources. And I'd say that's probably true for 50 or 60%. But there are a lot of people out there who who have resources and they just don't know what. It's very complicated, as you know, because that's really the problem you're solving is decomplicating this problem.
That's exactly right. And creating an advocacy network, right? Like, I think that part of this is, you have an adult child that lives across the country, and that adult child is caring for their own kids. This classic sandwich generation stuff. And they're thinking about high school college applications and dorm rooms and all this other stuff. But they're also thinking about, what is mom going to do? She's got no money left. She's living in this house that's falling apart around her. She can't stay there, obviously, but I don't have the capacity or the time or the wherewithal to start figuring this out, let alone in a different time zone in a market that I've only visited. I've only been to Delray Beach 13 times in my whole life. How am I supposed to help her find a facility? Yeah. So that's where we come in, and we provide advocacy, but we also allow for access. And I think advocacy and access are two things that are sort of overlooked when it comes to housing, because everyone thinks, well, there's just not enough housing, so like we're not going to even try. But the reality is if you tried a little bit, or if you had an expert that was helping you do this, you would find that with the right advocate, you could understand what the access was and actually get things done and get people moved and do it appropriately. And everyone's better off. Everyone wins. There's an ROI for the health insurer. There's a satisfaction for the patient, for the member, for the resident. So it really is it's a win-win-win situation.
Well, what I love about this is more than anything else is that we have created this system that is so complicated as you get older. So I'm 70. More doctor's visits, get to collect Social Security, Medicare Advantage. And I'm pretty sophisticated. I live this. This is my world. And it is really, really frustrating. And it's really, really complicated. And I think about what it's got to be like for people who don't do this every day, who don't think about it. It just becomes impossible, and they just fall through the cracks, and lots of things they miss. And so I really love this a lot. So I asked you before we went on the air, I want to do a little storytelling. We don't do enough storytelling in the industry. I'm going to do the hard one first. I don't know, maybe it's not hard, and then we're going to do the maybe more fun one. Tell me a story about some failure you had and what you learned from it.
Okay, I've got a lot, as I alluded to before, but I'll pick one that's relevant in the early days of starting this company. The first idea that we had, and based on my grandmother's story where she found herself alone at 87 in this big house, we said, okay, well, and you probably remember this, Steve, from when we talked years ago when we first started, but let's do roommate sharing for older adults, co-living for grown-ups, we were calling it. And we're like, this is going to be the next big thing, and it's going to be simple and clean, and everyone's going to want to do it, and it's just going to be like the Golden Girls. And you've heard this story 100 times throughout your years in this industry, like this perfect rainbow situation. Anyway, I quit my job when we first started the company, and I rented personally a 3-bedroom house in the suburbs and said, we're going to do this and it's going to be great and it's going to be perfect, and we're going to find the perfect house, and we're going to prove the model out and then copy and paste it all over the country. So I scraped my last pennies together and rent this house with my co-founder, Peter. And it was a nice little, it was a fixer upper, but it was fixed up enough. And I spent, a lot of time like back and forth to Home Depot, putting fresh sod in the front to make it look good and open it up for showings, and made all this marketing collateral and all this stuff, spent literally hours and all of our money. And nobody showed up. We put ads in Craigslist. We put ads on Facebook. We put ads on Instagram. Nobody showed up. We're like, what is the deal here? We can't even get one person, forget about just matching people, but we can't even get one person to buy into this idea here.
To even look, yeah.
So what did we do? We're like, okay, well, maybe we need to get furniture. Let's furnish the place, because maybe they just can't see themselves in this, like staging a house for when you sell it, right?
Yeah.
So we find a staging company, and to try and save money on the staging company, they said, well, you can get your own U-Haul and you can bring the stuff from the warehouse to the house yourself. And so we rent a U-Haul, and we back and forth from the U-Haul, and we're sweating. It's Florida in the summer. And I almost break my toe getting the couch in the front door. Sure enough, we staged the whole thing. We relist it with all these glitzy pictures. We get a realtor involved. Still nothing. Nothing. And then what happens after the house is we're away for a couple of days? the floorboards start coming up because it's so humid in there and the air conditioning doesn't work well. And we're like, this is never going to happen. Anyway, long story short, we were able to get out of that lease, and we realized that single family homes were not going to be sustainable to build a real scalable business here.
Yeah.
And so we started thinking about, like, how do we do this at scale with apartment communities? And that's when we sort of started like pounding the pavement, working with apartment communities, sharing our kind of foundational idea. And thank God for that experience, because I think we would have gone really far with single family homes, and we would have had a disaster one way along the other.
Yeah.
One point or
No,
another.
that is a great story. I had a similar story. I built some senior 15-bed homes in Northern California when I was in my late 20s, and I thought everybody picked based on money, and so I built the smallest units I could, and we tried to make the pricing very affordable. And somebody else came along and built this farmhouse, you kind of looking place with big broad porches, and it was way expensive, at least it seemed to me at the time, and they filled it right up. And I didn't understand that how many people had money to spend and how much they'd spend like that. It was a disaster. So that's a great story. Okay, one more story I'd love to have you tell is, tell me about somebody whose life you transformed.
Sure. We've transformed a lot of lives, so these stories it's hard to keep them straight at this point. But I can tell you one of the early ones that we helped, and it was a really cool one, and it was memorable for me because it was one of our first. A woman named Joanna. I can't share her last name. She was probably in her late 70s when we met her. And she was living in a very small efficiency apartment. And she had a very, very, very bad landlord. And the landlord wouldn't fix anything, and there was no air conditioning in the unit. Again, this was in Florida. She had two big cats that she couldn't care for. She couldn't lift the cats up, so she couldn't move them. It was a challenging time for her. And she had an eviction notice on her door. The landlord's like, I'm tearing this building down, and we're going to build something new here, like multifamily, whatever. So Joanna gets hooked up with us, and she's like, this is a perfect opportunity here to help. I need help. And we wound up in a very short order, we found Joanna an incredibly nice apartment nearby, but in a new community. The unit was new. She had all new appliances, and it was clean. We hooked her up with a housekeeper, which she had never had before. She didn't know she just couldn't figure this stuff out on her own. She had no relatives, no living relatives. She had a niece that was in a different state that really was not very involved, but that was the closest living family member that had any responsibility for her. And she moved into this new unit. We helped rehome her cats to a new home with a loving owner, which she was incredibly grateful for. We installed shower grab bars and some threshold covers in her new apartment to make sure that she was safe and there. And Joanna lived in that unit. It's been 5 years. She's lived in that unit for 5 years stably. And she's obsessed with us. She's happy as a clam, and she's forever grateful because we found her something that's long-term and sustainable. And we got her out of a really sticky situation that she really couldn't have stayed in very much longer.
Man, I love that story, because I think that when any kind of aging services is doing it right, it's ultimately about changing lives. And it's hard because it's mostly changing one life at a time, right? And yet you've been able to do that at scale for thousands of older people, which is really terrific. So if you had a magic wand and you could change one thing about how America thinks about aging, what would you change?
It's a really good question. I think you mentioned ageism is not as big of a problem as we make it out to be. And I think that's mostly true. I think that if we're all living longer, and I think that if there was a magic wand, I'd want to make sure that everyone has resources to sustain this longer period of life, because it's very much necessary. We all are going to need it. If we're lucky enough to live long enough, we're going to need some support. We're going to need care. We're going to need a decent place to live. And I think a lot of times people are outliving their resources, and it's a scary thing to be a part of. And so if I had a magic wand, I'd give everyone the resources that they could to sustain a good quality of life.
So it sort of feels like, so I'm going to step back for a minute. As I was telling you before we went on the air, I think I'm maybe about the only person in the senior living industry who there's a general belief that we are, and I'll ask you your opinions. I told you I was going to talk about it, but I didn't actually ask you your thoughts. But the general belief is that we are heading towards a major crisis where we won't have enough senior living units for the growing population of boomers that I'm a part of. I actually think that's not true. And I think it's not true in part because of the organizations that are rethinking housing for older people, even those with needs. Do you have thoughts on that?
Yeah, I tend to agree with you. I think it's similar to this. I studied economics in college, and I learned about the peak oil theory. We're going to run out of oil. We're going to run out of oil. We're not going to have enough oil. But every time we get close to running out of oil, or think we get close to running out of oil, we figure out a way to use it more efficiently, or we find more of it, or we figure out new ways to drill for it better or more efficiently. So similar to, peak senior living, I think that we will find ways to use the capacity in housing that we have. We'll find ways to use it better. People will live longer at home because they will be able to live longer at home because people are living a higher quality of life. And I think there'll be new versions of what we now call senior living to also, to help with the demand.
Are you worldwide? I mean, are you across the country, or are you geographically limited?
Yeah, we're across the country.
So if I'm a senior living operator and I've got some units I'm having a hard time filling, should I be calling you?
Absolutely. We're happy to talk.
Are you listening, Brookdale? They've got pretty low occupancy still. I don't know how you feel about that, but they would seem like they'd be great. This has been a great conversation. I love this. You've got the websites up on the screen. You know how to find Jake. All I can say is we need more people like Jake really rethinking this. There are a lot of people who are doing it. This is amazing. And you solve big problems that I know that I'm living and just figuring out the resources and how to manage care for a lot of people. And that's terrific. 5 years from now, where are you going to be?
All over the world, hopefully helping people get housed stably everywhere.
Great. Thank you very much for joining us. And I hope you have a great rest of your week.
Thank you, Steve.